program are not necessarily those of the staff and management of Salem Media of Hawaii.
Aloha and welcome to Be Fit for Health. This is Bianca, your host. It's another great day. I appreciate all of you taking the time out to listen, and I promise you this show will be excellent as always. We have another incredible medical doctor on our show, and this will be on the topic of a continuum of women's health. And I know that this is important, even though, the month has ended. We're still in the beginning of the new month, but at least we end it properly by discussing a topic that most of us are so confused about when it comes to the latter years of a woman's, function of her, I guess you call it, when we have the change, quote unquote. Anyways, I want to introduce you guys to an incredible doctor. Her name is Dr. Cheryl Lynn Rudy. She is, in fact, a very well-experienced medical doctor. She is an OBGYN, and she's a founding member of the Hawaii Women's Health Care. And this is a group of women, medical doctors, who have been voted best doctors in 2020. So she has been, she's actually graduated from the University of California, Berkeley and Davis. So she's no small fry here. And she's also done her residency here at the University of Hawaii, and she's board certified American College of OBGYN. So I want to welcome Dr. Cheryl Rudy. Are you on?
Yes, hello.
Oh, hey! Hello.
I'm here.
Yeah, great. You know what? Thank you so much. I know you're super busy, and being one of the head doctor over there, I want to say thank you so much, because I know what you're going to be sharing with us today is so important and so needed, because I think this is one part of women's health that I think we kind of know, but not sure when it comes to the way our hormones function in our latter years of our age. And I want to know from you the specifics, because a lot of assumptions are out there, a lot of, guessing for when it comes to people like myself. I mean, I think I know my body pretty well, but you know me, I don't have all the answers. So even though I think I do, you correct that for me. I appreciate that. So tell us a little bit about your history here in Hawaii and what you've accomplished, being the fact that you guys got voted the best doctors for 2020. This is incredible. Congratulations, by the way.
Oh, yeah. No, that's really sweet of you. Thank you. It's a pleasure to be with you. Yeah. So, when I graduated from the residency program at University of Hawaii, myself and Dr. Leiloa, we decided to form a group practice, and that's been over 20 years now.
Wow.
So it's an amazing journey to take, and we love what we do. We love taking care of women of all ages, as young as preteens all the way up to, the 80s and so on. And being at this for 22 years, we get to know our patients very well, and
right.
we see them grow. And this, going to this, like you said, this latter part of a woman's life, the menopausal years, we see that quite often in our office. And you're correct, there's a lot of confusion about it. In the past, it's never really talked about. But now with awareness and also the advancement of medicine, it's incredible. So there's a lot of data out there, and it's always changing. So it's keeping us doctors on our toes, and we're trying to make sure that we give the correct information to our patients as well, making sure they stay healthy.
Yeah, I appreciate that about you, because, you are an educator as you are, someone's doctor. There isn't too many people who take that time to do that. And I think it's so important, especially when it comes to a delicate topic like this, because it lasts a long time for some. Menopause is not no joke, because, one of the questions I was going to ask you is, what is the difference between perimenopause and menopause? Isn't it menopause, what is those two differences, so that we understand how long it's going to take?
Yes. No, that's the basic question that, a lot of women ask. What's the difference, and how do you diagnose it? So I'll start off with menopause. Menopause is kind of it's a clinical diagnosis, and it's pretty straightforward. It's menopause signals the end of a reproductive years for women, and it's diagnosed by when a woman has no period for 1 year, no menstrual period for 1 full year. That being said, the years leading up to that is called perimenopause, and it's that gradual transition between the reproductive years and menopause, which can be years, which can take years, an average about 4 years. And during those years is associated with irregular menses, hot flashes, night sweats, and vaginal dryness.
Wow.
So, and these symptoms do continue as a woman becomes menopausal and for some postmenopausal. So the average age for a woman to become menopause is 51 years of age, but it can be anywhere from age 40 to the late 50s.
Oh, wow.
So
it's such a wide range.
Mm-hmm. Yes. There are some studies which show that when a woman becomes menopausal, may be linked to what their mom or sisters do. So there's some familial association that's been found. Yes, but it's kind of wait and see, to be honest.
Now, could this also be a factor if someone has cysts in their ovaries, or if they have developed their bodies later, as far as earlier? Does that make a difference when you are set to go into menopause?
Yeah, it's not that straightforward in terms of whether you got your cycles earlier in life or later in terms of puberty. Is that what you mean? Or
yeah.
No, not quite. Doesn't really tell doesn't forecast what you'll be in terms of when you start puberty and when that will tell you that you'll get your menopausal years.
So what if you're somebody who's very irregular or have the polycystic ovarian syndrome? Would that also affect your body to shut down quicker or later?
It's going to be harder to tell because if you are irregular in your cycles, it'll in some women, when they have these other conditions, which cause them to have irregular periods, some of them will not have a period for 1 full year. Wow. That's why if it's before age 40, then we do need to do a workup to see that it's probably not menopause. It might be some underlying condition, like the condition you said, polycystic ovarian disease and other things. But at age 40 on, you need to do some detective work to see whether it's menopause or is she polycystic. And at that point, you can do blood test levels to help you diagnose that. Do a workup, ultrasounds and blood levels of hormones.
And that would give you a better understanding whether or not someone is or not, yeah?
Right.
Okay. Mm-hmm. Well, that's good because that way, those of us who are regular or not regular, you kind of have at least some kind of understanding that it may not be a factor. It may not be a factor. You have to go see your doctor to find out. So, like I said, when you're assuming things, it doesn't help you in the long run. And a lot of people don't go see their doctor and they wait it out. And that's not something you want to do either for that. But so perimenopause is can be 5 years prior to you or sooner or later, depending on who the person is, before you even get into the actual menopause. How does that work? What is those symptoms? So perimenopause is women start to have irregular periods. And in the classical sense, they start losing their periods. They become further apart. And they start, instead of having regular periods every month, they start having every 3 to 6 months. And then along with that, they get the hot flushes, which feels, makes them feel warm without any predictability. And this can happen at night, and they're called night sweats at that point. Fun.
And then, yes. So these symptoms are often erratic, and it's due to the varying levels of estrogen that's being produced by the ovary. As the ovary ages, it starts, instead of giving out a cyclic amount of estrogen, it's very erratic. It can be very high and very low all of a sudden. That can cause the symptoms of the hot flushes.
Now,
women experience...
Go ahead. No, go ahead. Finish your thought.
Well, I'm just saying, women. I get a question. What's the hot flush like? Because they think, but they don't know. It's always hot here in Hawaii.
Yeah, exactly.
So, and it's hard. Sometimes if it's a very mild symptom, you don't know. You just kind of just wait it out. But it's very obvious if you're in an air-conditioned room and you feel this flush coming from your chest, through your neck and through your face. And if it gets severe enough, you perspire. You may feel your heart racing a bit.
Oh, wow.
That's more kind of obvious. But it's kind of like, and then you associate with other symptoms that you may be feeling. You may start noticing your periods are coming a little bit later, and also you may start noticing vaginal dryness. So that's all associated with declining estrogen levels that your ovaries are making as you transition.
So is there anything that women in perimenopause, menopause is menopause, but is there anything that women with perimenopause can do to slow down the symptoms? Is there foods they should be consuming? Is there supplementation they can take? Is there a type of exercises they can do to help, at least control it to some degree?
Yeah. So I think when women are going through perimenopausal, when I see them and they describe the symptoms they're doing and what they can do about it, the first thing I like to tell them is just to let them know what's happening to their body. So I think educating women about it and understanding it, and also I try to really help them embrace this new phase in their life, because when these things happen and it comes in an uncontrolled fashion and unpredictable time, it can be anxiety provoking.
Right.
And so it causes a lot of women to become very, very upset. And
I would say depressed. Because you don't know what's going to happen, right?
Right. Well, you worry about, something wrong with me.
Right.
How come I'm getting so irritable? It can be a point where it can negatively impact a person's life.
Right.
So learning about it, understanding it is key to helping control these symptoms. Because once you start feeling warm, you start feeling anxious, then it can almost, it can escalate. But once you understand, okay, it's one of those things, just take some nice deep breaths, and it will dissipate soon. So educating, embracing, also doing things like exercise, like you mentioned, yoga. Studies have shown that yoga helps with these symptoms. Lifestyle changes, in terms of minimizing caffeine, and smoking. Definitely smoking can trigger these symptoms.
What about sugar?
Sugar, leading a healthy lifestyle, yes. Being in your optimal weight, someone who's more unhealthy, on the heavier side, the studies have shown symptoms can be more severe. So,
right.
So a healthy eating pattern and exercise would definitely help.
Yeah, a lot of women don't know where to resource this, though. So educating themselves, where would they go to look some of this stuff up without having to go through Google? Because Google's got good information, but there's a lot of bad and misinformed information. So is there any type of website, or do you guys have a website that they can go and research on, or for that kind of stuff?
Yeah, so, there's the American College of OBGYN. We call ACOG, ACOG. And it's our major what do you call it, organization.
Yeah.
Which is and it's valid, and actually that's where we are part of, and they make sure that we're up to date with our continuing medical education, and they provide good data-based information.
Oh, that's great.
That's a good website. Yeah, you're right. But there's many websites out there, or a lot of them are anecdotal, and a lot of them are, not valid in terms of research.
Right.
So it's good to make sure that they research what site they're looking and make sure it's. A lot of the universities' websites are pretty good too.
Yeah, it's really hard to read any type of journals or publications to the average person, because they don't understand the medical lingo. So it's hard for them to keep up with the data. It's easier if you're having maybe a newsletter written about particulars of these symptoms or things you can do to avoid severe symptoms. It helps women to be able to, at least attention span wise, be able to continue with understanding what they should be doing and not doing.
Yeah, and I have a lot of women that come and they bring in data that they've read and researched, and I always find that helpful. So I'm able to look at it and give them, my advice in terms of, whether the data they're looking is correct or has some flaws or something that, need to be careful at. So it's always good to just follow up with, your own physician.
Yes.
If you read something that you're interested in or want to, pursue.
So I think what the next question for me is, and I know you kind of answered a little bit, but how long does it usually last? Once you're in menopause, I mean, I feel like my mom is still in it and she's in her 70s. And I think she started when she was like 50, 51, maybe like you were saying. But some of the hot flashes, it's not severe, but it still has her moments where she'll look at me and go, it's coming.
Yeah.
So I'm like, okay.
Oh, thing, yes. So most women, they experience hot flushes anywhere from 6 months to 2 years. Now, of the women who are going through menopause, only 80% of us will feel it.
Wow.
Will have these symptoms. So 20% of these women
lucky
actually are lucky. They gracefully have their last period, and then that's all. But the majority of us would have something, some sort of symptoms. And of those 80%, 20% would have it so severe where that's when they're in my office, wanting to know what's happening, what they can do. Now, but they can actually do last a long time, as long as 10 years. And then for a few minority, all the way up the rest of their life. And like you said, your mom, I have women, older, like 70, they still feel hot flushes. But hopefully by that time, it's just very mild and tolerable and not too frequent.
Yeah, but it's not fun from what I see from a lot of women. It's terrible. And it comes at the wrong time too, especially let's say you have a job interview and all of a sudden you're like sweating profusely. That doesn't look good. So what can you do as far as keeping your hormones healthy enough so that you're getting the necessary, because hormones are a big part of the way our body functions. Without our hormones, there's many different types of hormones, but our female hormones play a big role in keeping our heart healthy. The brain fog thing that comes along with being in menopause. What can we do to keep that portions of our bodies healthy so that we don't have secondary issues?
Yeah. So, in terms of what to do, I think some people believe in replacing these hormones. When I was doing my residency many years ago, that was the standard of care, where the thought of, okay, women are benefiting from estrogen and it's declining, let's replace them. So hormone replacement therapy was a very common form of medication for all women that we used to give, but there was this pivotal study in the early 2000s called the Women's Health Initiative, which basically looked at hormonal replacement therapy and the long-term risks for women. And it showed that, unfortunately, that replacing hormones for long-term can increase a risk for women's risk for breast cancer, stroke, heart disease, blood clots. So since then, there was almost a 180 turn in our care of women, menopausal women, not to give these hormone replacement therapy, because we didn't want to do more harm than needed. But for women but we've come down to the conclusion that it should be an individualized treatment for menopausal women or perimenopausal, menopausal women, that we would treat them with hormone replacement therapy if their symptoms warranted it. So that's where we are now. So in terms of preventing it, we can't prevent these menopausal symptoms. Again, 80% of women will get it. And it's just knowing that that's normal and natural. But for those women who are getting it so severe that it's impacting their quality of life, then yes, we can help them with hormone replacement therapy.
Yeah, I was going to say, for those women who have like polycystic situations and irregular periods, I would assume these are the women who would probably be suffering. No? Am I assuming wrong? Because they already have off-balanced hormones.
Yeah, so polycystic ovarian, so these are women who are perimenopausal, yes. Once you become menopausal, then the definition of polycystic ovaries is gone because they're not
producing eggs anymore.
Yes. But perimenopausal, yes, they can, for them, they're a different subset of women and condition, and yes, they could get, they can be on hormone, usually birth control pills to be specific, to help cycle them and make their hormones cycle better so they don't have those symptoms of irregular periods.
So if they get on the birth control pill, though, doesn't that stop their, well, no, I guess you could still have your period. So does it force you to have your period then, even if you're supposed to not have your period anymore? I don't know how that works.
Oh, yeah. So, yeah, for polycystic ovarian, yeah, it cycles the woman, and it can make the lining of the uterus shed regularly instead of accumulating, and then it, because with polycystic ovarian process is they don't have regular periods, but when they do, they have it very heavy, and that could be detrimental. So we try to cycle them, with hormones.
So does that affect?
Those are usually.
Go ahead. No, your thoughts are important.
The younger women.
Yeah.
They are usually the younger women who have that. So that would be a different type of therapy from hormone replacement therapy. So they have enough hormones. It's working. It's just not cycling regularly. It does become, then as these women with polycystic ovarian disease process get older, it does, that there's a gray area there, whether is it part of the polycystic or is she going through perimenopausal? And that would be a complex patient,
right?
And someone that I would work with and help them. But they're different from the general population who don't have the polycystic ovarian.
What about the women who have endometriosis along with the poly and in the phase of possibly getting into menopause? So would that cause them to have more complications?
Women with endometriosis? Yeah. No, actually, as women with endometriosis, there are a subset of women where getting to menopause would be helpful for them because, and it gets kind of technical. Endometriosis is a condition where they have endometrial lining in their pelvic cavity, and the hormones are causing it to grow in there. But once they become menopausal, there's no more hormones. So actually, they are better when they become menopausal.
How nice!
Have to have, So
that's a positive in all of this. I love it.
It's a positive, yeah. So we're trying to get women with endometriosis, which has severe pelvic pain from to get them to menopause if they're not interested in getting pregnant anymore. But so then they don't have to, So
if you're
there's some.
I was going to say with endometriosis, does it because if you have the drying as well? This is kind of a sensitive topic, but we'll try to keep it as medical as possible. When you're drying, does the endometriosis be a factor in that too, or is it worse after everything is smooth over with the endometriosis? Does it make a difference with the drying factor?
No, not really. You mean with having endometriosis, having more vaginal dryness?
Yeah.
No, they're probably not any different. No.
Okay. And these are questions I am telling you, women out there that are listening to this are going to be asking in their heads. So I'm just going to ask you these questions because I know it's in their minds. But it's really complicated and not. It's the only complicated part is when you have to deal with these other syndromes that are occurring with someone prior to going into menopause. And there are, factors of, like you said, once you're in menopause, the polycystic is gone, which is a big factor. And like you said, in pelvic pain, correct? So that's a good thing. So in that spectrum, I guess women should be welcoming menopause, because that's a wonderful, wonderful way of going into a new, so to speak. Is there any other things that menopause can relieve for women that are dealing with any type of pain and discomfort down there when it comes to their health?
Relief in...
As far as discomfort and pain, so like polycystis is gone. Is there any other like diseases or ailment that women go through that we would be excited to be getting into the next phase in our lives, because it will calm it down for our bodies?
Oh, so so menopause is, there's a history of women who have heavy periods, who deal with prolonged periods due to maybe fibroids, which is another female condition when there's the uteruses are enlarged by tumors. So these fibroids or tumors are stimulated by estrogen, and when a woman goes through menopause, the fibroid stops growing, and they also can shrink, and also the heavy periods will then dissipate, will then go away. So that's another.
Well, we're going to take a really quick 15-second break, but I have some other questions leading up to that comment that you just made, because there is women that have all the cramping and things that go along with heavy periods. But at the same time, along with that comes with like nausea and stomach issues and, symptoms of IBS. So we'll clear up some of those things too. So we're not going to go right. Just hang tight for 15 seconds and we'll be right back.
You don't need to be a member of a gym to get your health and fitness back on track. Be Fit for You with a Be Fit for Health online personal training and nutrition program. With 30 years of personal training experience, Bianca will help you better yourself and be fit for health. For more information or to schedule a free wellness consultation, visit befit4health.com for more.
Okay, we're back with Dr. Rudy. She is the OBGYN head of Hawaii Women's Health in Kapi'olani Medical Center. And she's been talking to us about, the second half of women's, state of well-being and our change, quote unquote. I don't know how else to say it without sounding negative, right? The change should be a positive, right? You're always growing, evolving, that type of thing. But we were just talking about how some of the positives that come along with menopause and the wonderful news that you shared with us by, some of the ailments that we've been suffering. And one of them was kind of like PMS syndrome with her heavy bleeding, the cramping. Along with that also comes with nausea, some stomach upsets, some maybe IBS symptoms because of the cramping that is trickulated through the ovaries and the uterus. So I would assume with everything said and done, once you've gone through the change with menopause, most of those symptoms that are related to the PMS is pretty much gone, right? You don't have any ghost-like PMS that trickle on afterwards. Is there like a residue that come on every month? Like, I remember you're supposed to have your period, but now that you don't, we'll still give you the symptoms? Like you're going to have one? Does that happen?
Yeah. Yeah, it can happen. Yes.
That's not good news.
Yeah. So but it's a transition, and then towards postmenopause, then that's gone. Yeah. Then you don't have it. So it's during that perimenopausal that you do when you start losing your periods that you're not bleeding, but you're still feeling all those kind of PMS. Your breast tenderness and bloatedness can still be there, but that's just again. As the transition through the years, and when you reach menopause, then it should definitely be just gone. Yeah.
What about cancer too? I mean, I was going to say, along with the positives that come along with, what are the chances of women developing any type of uterus cancer or breast cancer after menopause?
So yeah, unfortunately, as we get older, and for all men and women, the risk of cancer does go up. So. Breast cancer, that's why we start doing mammograms at age 40, because as we reach our 50s, that's when the risk of breast cancer is highest as we get older. Uterine cancer, ovarian cancer, yes, is the higher risk group are the older population, the postmenopausal women. One cancer that's not is cervical cancer. In fact, we stopped screening for cervical cancer at the age of 65 because the risk of getting cancer from cervix is not there. So that's one thing that's positive.
That's very good.
Yeah.
And so
But
if you, I would say that for people who are in menopause, the chances of you still getting some form of cancer is still there. I mean, if you still have everything intact then, except for the latter that you just mentioned. What about the ovaries? Are they safe, even though we're not producing any hormones from there? I mean, we still have it, right? I mean, we still have estrogen to some degree, and we still have progesterone to some degree there. Is it still a risk for the ovaries?
It's higher it's higher in older women. So that's why it's recommended that, a lot of women, when they stop having their babies, and as they get older, and they feel like they don't need to see the doctor. And I remind my women who don't have their periods anymore and don't think they need to be seen, that they still need to come in, because we don't have the best method for detecting ovarian cancer. The best we have is doing a pelvic exam.
Right.
So doing a yearly pelvic exam with your gynecologist is important, because and that's when we can palpate and feel for the ovaries and uterus and make sure there's no enlargement. And we also ask key questions in terms of, what you're feeling. Are you feeling any bloating, any abdominal pressure? Because sometimes the onset of these cancers is very vague and nonspecific. So yes, it's important to continue yearly preventative care with your doctor.
Yeah, because you can't really tell, because it's so deep-rooted within our bodies that we can't really feel the symptoms of anything that might be growing that is not supposed to be there. But I would say that the only one that I think is very apparent is the polycyst, where you may develop a cyst prior to your period, and it goes away usually if it's benign, right? After you have your period, but sometimes it doesn't. So you'll have those symptoms, and that might take you to the doctors. But yeah, yearly checkup. I had a friend who is in the mainland, and she really rarely went to her OBGYN, and she had a cyst that was the size of a baseball. It wasn't really good for her. Obviously, they had to surgically remove it. It wasn't really good, but it was benign. But I can't even imagine the pressure and the being uncomfortable, with that. I know I'd probably be at your office in like 2 seconds. I wouldn't wait. Knowing me.
Yeah.
Yeah, it's crazy.
It's a lot of people feel as they don't. Yeah, they only come when they feel something. But that's what you want to do, is not get to the point where you feel something, because then it might be too late. So at least doing a yearly exam when you're feeling great. We're here, the doctors are there to confirm that, things that can be detected earlier are detected earlier. Yeah. Then by the time you feel anything, it's on the later side.
So tell me a little bit about your office too, doctor, because I know that you guys do your traditional, check, the yearly pap smear, and but there are other things that you are capable of doing in your office. What are some of the services that you guys have there at the Women's Center?
Well, oftentimes, you mean like in my office specifically? Yeah. In terms of, well, oftentimes, women see their OBGYN as their primary care doctor. And so what we like to do is also do some primary care. So we're very comprehensive in our care, making sure that other aspects in the woman's life is being monitored. So we like to check on cholesterol and sometimes diabetes screening tests. That's what we do, because sometimes women are so busy today with family, work, that they don't have time to see their primary care doctor or internal medicine and family practice.
Right.
So we're committed to making sure that, if it hasn't been checked, we'll check it. And if it's abnormal, then we definitely would emphasize the need to see their primary care doctor and make sure that they're not developing diabetes or heart disease with high cholesterol.
Right, especially
That's
at
one of the
menopause,
things.
right? They say after menopause, you have a bigger chance of having some kind of a cardiovascular disease or some kind of issue with your heart.
Right. So with the declining estrogen levels, unfortunately, it puts a woman at higher risk for heart disease. And heart disease is the number one killer in menopausal women.
Oh my gosh, that's crazy. Wow.
Yeah. So that's forgotten. So that's why we always ask if they've seen their primary care doctor, are they up to date with their routine blood test screening? And if they're not, we tell them to, but usually the following year they haven't seen them, then at that point I'm like, I'm going to do it today. And we have that capability in our office. So we're good to just to spot check, and if it's normal, good, and then we just counsel them on how to maintain that those good levels with diet and exercise, and if it's not, then we definitely tell them about the risk of having high cholesterol and how that can lead to plaque formations around the coronary arteries, which can lead to a sudden, cardiac event. So.
Yeah, or the triglycerides as well, right? Because the diet is everything. Mm-hmm. I would say that also for women, is it the heart part of it? I mean, because I'm sure the women that are listening to this, they're going to be like, what does that mean? So is it estrogen per se, or is it a combination between estrogen and the progesterone levels that are causing us to be protected up until the point of menopause? Because how can we keep the estrogen or progesterone levels at a level so that if you're, genetically prone to it, and more so than someone else, how can we protect ourselves from getting, let's say, a cardiovascular disease that would relate to a heart attack eventually?
Yeah, so there is the heart and actually the bones have estrogen receptors, and they do maintain it to be healthy. And with the loss of estrogen, that's how it increases the risk of heart disease, because that's why women who are menopausal, their risk for heart disease equates that of a man. Women are protected during the time that we still have the estrogen, but once we become menopause, then our risk for heart disease is like a male counterpart. So it's not healthy. Through studies that we've seen, it's not healthy to replace. We used to give estrogen thinking it'll help the heart,
right,
but somehow that doesn't equate to protecting it. So the best way we can now is through lifestyle changes. So watching what we're eating, making sure that we're not eating high cholesterol, high fatty foods, and also exercising, because exercising does decrease cholesterol.
Do you know of any supplementation like maca root or was it not supplemental, but something oil? It wasn't. I can't think right now. My brain's not working. But there are some supplements out there that some women take, black gohash, things like that help with keeping our hormones on a natural level, I guess, up there.
The over-the-counter herbal supplements.
Yeah.
Yes. So that's, So there's many out there that state that it helps with those hot flushes, the mood swings, keeps the heart and things and other things healthy. Unfortunately, there's no evidence-based data to support that.
Okay.
And I do have patients who do take them, and I always want to know if it's helping them and whatnot. But I get mixed bag of results from the patients. Sometimes they feel like it helps them, but there's always a placebo effect where it helps them. But I just tell them that there's no data to support what they do, and also there's no oversight of the quality assurance of what you're getting over the counter, because it's not managed, it's not overseen by the FDA, the Food Drug Agency. So there's sometimes it may not be exactly what it is, and it might not be the right dose. So that's one thing I tell patients about, and they can make an informed decision based on it. So I usually don't recommend it, but if they're on it, as long as they know that information I gave.
Because you don't even know how much of a dosage you're supposed to take in order for that to actually work. And that dose must be too high for that particular person because they may have other things going on. So, maca root is not a basic herb. It's actually used in Chinese medicine quite frequently, but it can be dangerous if it's mixed with something else. Just like in, pharmaceutical, chemical medication, herbal medication, if it's mixed wrong, it can also do some damage. So you got to really understand what you're taking and why you're taking it. And it's always good to go see a medical professional to help guide you, even with herbal supplementation. You should know what you're talking about and doing. So that's why I'm asking you, because if you have had experience with your patients and they've tried it, some of them may have not taken it properly either. Maybe they're not taking it enough or taking too little for it not to work. But it also could be not enough studies in our normal, publications to show that some of these herbs are, in fact, helpful. But, anything at some point, I think for some women who are desperate to get rid of some of the symptoms, I think they're willing to try anything to get some normalcy. So any thoughts on what else we can be doing to keep our bodies in tip-top shape? Because I know, because you guys are a healthcare center, you guys not just, for women's hormones, I know you guys can do surgery there too, right? Like outpatient type of small type of surgeries for patients who may have maybe, something as far as growth in the uterus, because I know there are things that you might be able to do that aren't so complicated, so you have to go to the hospital for. What are some of the procedures you can execute out of your office?
Yes, we try. So we do quite a bit of outpatient surgery that's safe in the office. So a lot now with technology, we can do that. So sometimes we have women who come in bleeding, and we find that they have a polyp inside the uterus.
Right.
And so we can do that in our office in the outpatient setting.
Great.
So it's it's not under any type of anesthesia, but usually local anesthesia, because usually there's no incisions being made. We can do it safely in the office.
Wow,
so
that's great.
We try to do quite a bit in the office where it's safe rather than going through the hospital, because a lot of women feel uncomfortable going to the operating room, and sometimes when you do, you have to undergo, IV sedation or anesthesia, and that is sometimes not needed for a lot of these procedures that we can do now. So we do ultrasounds, we do hysteroscopic procedures.
What's
That's what
that?
you call it that's the procedure where we put a little scope through the cervix into the uterus, so we can see the uterine lining and see if there's a mass, like a polyp.
That's fun.
And take it out that way. There's also a procedure called endometrial ablation with people who are heavy bleeders, and we find that there's no mass or anything abnormal, and there's no abnormal cells. It's just luck of the draw that they are heavy bleeders. So this ablation is that it kind of burns the lining. I know it sounds kind of
intrusive, but it's not.
But it's not. And it burns it, so it takes away that layer of endometrial lining that gets stimulated by the hormones every month before it, and then gets thicker, and then it's shed. So that thins it down. So there's not much tissue for the hormones to stimulate every month. So women end up having better periods or better menstrual cycles. For some, sometimes no periods, which a lot of women want.
Oh, wow. That's crazy. Isn't it amazing? Technology is so wonderful when you can actually do it quickly and technically painlessly, because of the fact that a lot of this, maybe 20 years ago, you had to go into the hospital, right? Maybe even 15 years ago.
Oh, yeah. Yes.
So you've seen all the changes.
Yeah. Quite a lot of changes, yeah. We used to, admit, even for routine surgeries now in the hospital, we used to admit them the day before and have them stay for like so many days. But, with studies, we know that it's better to get a patient out and going, out and up, and decrease the risk of, blood clots to the legs.
Right.
And so trying to do more outpatient surgery, minimal invasive surgery is what we call it, where you don't have to make a big incision and just can do a smaller incision on the abdomen. That's a big role in the gynecologic surgery, trying to do as little of incisions on the belly as possible,
Right.
so that recovery is better, and also cosmetically too.
Yeah, I was going to say, I mean, that's the main thing that most people, especially young girls, if they have something going on, unfortunately at their young age, you know, they don't want to have a scar on their belly, you know, for any purpose. But so as far as your office is concerned, how can they get in touch with you, and how can they make an appointment to see you or your crew? Like I said, you guys were voted the best doctors in 2020. So, I mean, if you're going to go somewhere, people, this is where you want to go.
Very sweet. Yeah, no. So we're at Capelline Medical Center. That's where our private office is, and we have a good group of doctors. They're all well qualified, and they'll be more than happy to take care of patients that call in. Yeah, so they can call our number at 947-5606.
And you have a website?
Or they can go. I'm sorry.
Do you have a website?
Yes. So it's the name of our group. It's our group's name is Hawaii Women's Healthcare, and it's that name, hawaiiwomenshealthcare.org.
Gotcha. Because on there you have your pictures and your bios and your guys' procedures and services that you offer, correct?
Right. Uh-huh.
Awesome. Because I know after this show, you know, people are going to want to look you guys up and see, you know, where you're located, one. Number two, any questions they may have after this, they may want to reach out to you and see if there's a way of maybe getting some of those answers. Because a lot of things when it comes to, you know, this, you may see it to me once or twice and it doesn't register. It may take a couple of times for people to get it. So luckily this will be recorded for my YouTube, so they can look it up and listen to this again. And that way they can get the information again, so it's not going to be lost after this show. But I do want to have people be able to go somewhere as a resource. And the reason why I brought you on is because I know you're, you know, the best of the best. And I trust and respect your opinion on the woman's body, because you've done this long enough and you understand it really well. So I appreciate you really giving us somewhat of an education on the great things that came out of getting into menopause and the not so great things. But I do appreciate you giving us this education today. Any last closing statements you'd like to share with the audience as far as how to stay positive with this change?
Yeah, no, I really want to leave a message that, you know, it's great to be able to live long. We have the ability to have that quantity in years with just the advancement of medicine and just lifestyle, that you want to make sure that you, with that quantity, you want quality of life. And you can have that, and you can take control of that. And, you know, menopause, you know, is just a normal transition, but keeping a healthy attitude and healthy lifestyle can help you maintain that quality, which therefore can lead to a happier life, which I think is key.
No, and it is, and everything that you said, plus the education, the beginning of this interview, you basically said is really empowering ourselves to understand what we're going through, and understand you're going through it, because when you're starting out in menopause and you're premenopausal, those symptoms can be scary because you don't know what's happening. But what's great about this show is that now women have a place to go to get some of those answers properly answered, instead of leaving it up for Google. I don't want to discredit Google, but, you know, leaving it up for Google to saying what's going on with them. Because a lot of times it could be completely off. And it's better to go and get blood work done, get your urine test done, get a pap smear done, and get all the tests done, and then get the results and figure out where you stand. And blood work can show, yes, whether or not you are starting menopause.
It can, but we don't usually use it. We usually just base it on, you know, the history of symptoms.
Gotcha. Good to know. Good to know. Okay, doctor, I know I took up a lot of your time, probably a little bit longer than I promised. I lied. Sorry. You're awesome. I can't wait to reach out to you sooner than later. I want to come in and see you guys. I definitely need to make sure that I'm healthy and keep my body going because I just turned 50 this year. So, I'm right. It's knocking on my door. I'm not answering it, but it's knocking on my door. I'm telling it to go away, but oh well. Eventually I'll open that door. We'll see. But thank you so much, Dr. Rudy. You're the best. I wish you all the best, and I will reach out to you sooner than later. Thank you for everything, and hope you have a great rest of your day.
Thank you so much. It's my pleasure.
No worries. Take care.
Aloha.
Aloha. And we're going to take a quick 15-second break. And then when we come back, I'm going to have my closing statements. Lucky you guys. We'll be right back.
You don't need to be a member of a gym to get your health and fitness back on track. Be Fit for You with a Be Fit for Health online personal training and nutrition program. With 30 years of personal training experience, Bianca will help you better yourself and be fit for health. For more information or to schedule a free wellness consultation, visit befit4health.com for more.
Okay, well, God, this was a great interview. I really learned a lot. When it comes to women's body and menopause and perimenopause, it's always confusing. And I think a lot of us women, growing up, seeing our mothers and grandmothers go through, some of the weird changes that comes along with this. Back then they didn't have any answers. Really, all they had to do was go through it and suffer through it. But today we are lucky. We have technology. We have the internet to kind of help us, guide us through it. To take control over our bodies to a degree where we can at least live and sustain a certain quality of life, like Dr. Cheryl Rudy of the Hawaii Women's Healthcare Group suggested. So my advice to you guys is to reach out to their group, and you don't have to be their patient, but you can at least reach out to them and see where you stand with your body and your situation. Get the information so that you're able to then plan this out, like a workout. I'm a trainer. You take the information that I give you as a trainer. You have a program design and you take your steps. This many months I'm going to be doing this to get my body here. And then this many months I'm going to do this to get my body at this next level and follow through with it. Make sure that you have in mind, like I've always say this in every single show, your nutrition has to be on point. Me studying as much as I have when it comes to the human body and hormones and, the way our body functions when you exercise and what happens to your system. Exercise is really crucial. And I'm not telling you to go work out like a crazy person. I'm saying 3 times a week, maybe 20 minutes to 30 minutes every day. I mean, every so often you want to make sure you can up it a little bit or bring it down depending on how you feel that week. Because as women, our bodies do have their fluctuations. So 3 times a week, 4 times a week, depending on where you're at. Make sure it's aggressive enough so that your heart rate goes up to at least 70%. And then you want to be able to at least consume the right types of food. So you have 3 meals or 2 meals. Make sure if you're going to be doing that, you're specifically proportioning your protein, your carbohydrates, and your fats properly. So, and I'm talking good fats. I'm not talking trans fats. I'm talking like avocado, coconut oil, avocado oil, things like that. None of them cookies or ice creams, which is my weakness. So I got to stay away from that stuff, right? You want to make sure that you're maintaining a certain healthy weight so that when you go into the transition of menopause, you're not struggling. You're not going through these really bad symptoms. So I really want to implore you guys, reach out to me if you have any questions. I'm lucky enough where I've kept my weight at a good place, so I'm not too worried and concerned about me going through this. But I know there's a lot of you out there that may be a little bit overweight, maybe have other issues going on with your health. I'd like to help guide you, at least in the portion of your nutrition and your exercise. When it comes to your hormone health, definitely go to Dr. Cheryl Lynn Rudy. She will help you with what she can when it comes to your hormones and other aspects. It's a women's healthcare clinic, so it's not just, your hormones. All right, guys. I hope that helps. I'm here for you. I wish you all the best. Please make sure to check out my website, BeFitForHealth.com, and there has all that information. I'm around, so take care of yourselves. I'll see you guys next week. Stay safe, be healthy. Aloha.